The organising care theme covers lots of things, and as the name suggests, it's about how you organise, but that can be things like what the incentive structures are for individuals GPs or pharmacists or dentists. We've done a lot of work on that. It can be incentives for hospitals and other types of organisations. So we do a lot of work looking at have we got the right incentive structure in place, what are the ups and the downs of these different ways of organising. We also look at new things, new ways of organising, so that could be new roles. In dentistry, for example, we've got dental therapists who can take on some of the work that's traditionally done by dentists. We've got another big EU-funded project that looks at the different roles and the different skill mix to try and see how we can get the most out of the money that we've got in healthcare, because globally healthcare budgets are limited, so we have to try and do the best. We're also looking at things like whole system change, and what I mean by that is, for example, we've got a big project that's looking at stroke services. How can we organise stroke services? We could spread the expertise very thinly, but the trouble with that is we know the outcomes won't be as good. So we've looked at, can we centralise some of that, have specialist stroke centres, and then rearrange the way we organise care across the patch. Now, what we've done on that study is look at whether we could centralise some of the stroke services. We compared us with London where they did this and found that, yeah, it saves lives doing it that way. So now what's happening is in Greater Manchester, we're also reorganising services on the back of that study. Some of the stuff we do as well is looking at the services that are provided, not necessarily things that are new, but what's working well and what's working less well. So a study we're just coming to the end of is actually looking at forensic psychiatry, and that's things like Rampton, Broadmoor, these kind of specialist hospitals where we have mentally disordered offenders. And we don't really know that much about what goes on often in these places. So our study is looking at, can we shed light on this? And is there a way we can do things differently to improve the quality of life for the patients in the organisations? Well, in the organising care theme, we collaborate with a lot of people. So we collaborate with people within the university. I've said I'm in the Centre for Primary Care, so a lot of clinical departments, not just medicine, nursing, dentistry. We also collaborate with the Centre for Health Economics. And outside of the university as well, we have international collaboration. So the European project on workforce and skill mix is an example of that. And other universities across the country within the UK. So the study with stroke was a collaboration between us and London. Our research has got lots of challenges really, and one of those is we're in an ivory tower. We try to understand what's going on in the NHS. But we really do need to work closely with the NHS professionals and managers in the system. And that helps us in a lot of ways. They've got a lot of knowledge that we don't have. But also, the way we do our research is to go out into organisations and observe and talk to people and measure things really. So it's really important that we have good links with people in the local and the national health economy. In terms of how our research is making a difference, there's a number of examples, and one of the most recent ones, I suppose, is around the stroke services evaluation. And with that research, what we found was that the reorganisation that was happening in a part of the country, so in the London area, that actually saved lives. And where that hadn't happened in Greater Manchester, we didn't see that reduction in mortality. So there was a clear finding there that reorganising the service in a particular way saves lives. And now on the basis of that reduction in mortality, the services in Greater Manchester are being reorganised as well to improve the health outcomes for all the patients.